Good morning, everyone. Thank you to everyone for being here today. My name is Sam Buckley, and I'm a transportation planner with the New Orleans Regional Planning Commission and serve as the section director for the APA Louisiana chapter Metro New Orleans section. I'm very pleased to be able to welcome everyone to today's virtual lunch and learn event on healthy community design. We are very grateful to the Center for Planning Excellence for co-hosting and presenting at today's event. I'd like to introduce Lanisha Jackson, AICP, who is a community planner with Cpex and serves as the professional development officer for the Metro New Orleans section, to introduce today's session and featured speakers.
Great, thank you, Sam. Good morning, everyone, and welcome to today's Lunch and Learn hosted by the American Planning Association, Louisiana Metro Chapter, in collaboration with the Center for Planning Excellence, also known as Cpex. I am Lanisha Jackson, a community planner at Cpex and also a member of the APA Metro Board. And on behalf of Cpex, I would like to thank the APA Metro Chapter for giving us this opportunity to present to you today. Cpex is Louisiana's only nonprofit planning organization. We work with communities at all scales, from neighborhood to parish, helping them develop a shared vision and a roadmap to achieve that vision. We've now worked in over 50 Louisiana communities and work with state agencies to develop policies and programs to support local community planning needs. Through all of our work, we champion the power of good planning to build livable, resilient, equitable communities. A few housekeeping items before we begin. This webinar is being recorded and will be posted on Cpex's YouTube channel. You can also find out more about Cpex's work on our website, cpex.org. Additionally, this webinar has been pre-approved for 1 continuing education credit for certified planners. To log your CM credit, visit the American Planning Association website, planning.org, log into your account and search for the name of the event, Healthy Community Design, Understanding How We Plan and Design Our Built Environment Impacts Community Health. Please note that how it's written on this slide is how it's actually listed on APA's website. So you would have to type it in as is or use some keywords to search for the event, or you can also search for the event using the event number 922-6384. Today, we will be hearing from Jessica Kemp, Vice President of Cpex. She provides leadership across various spheres of influence to further Cpex's mission, programs, and resource development efforts. Jessica's professional and academic career has been focused on communications, funded development, community capacity building, and social justice. Jessica completed a PhD in English at Louisiana State University and a Master of Arts in English from the University of Rochester in Rochester, New York. She is a lifelong fellow of the Effective Leadership Program, a joint endeavor of Duke University, Southern University, and the University of Cape Town to cultivate leaders committed to social justice in Louisiana and South Africa. Jessica will be speaking about social determinants of health and their connection to planning and describing Cpex's newest initiatives to build knowledge about the relationships between our health and the built environment and develop planning tools and practices to help Louisiana communities leverage planning tools to address community health needs. We will also hear from David Whitley, Urban Design Manager at Cpex. David has a background in urban planning, urban design, public policy, and development-related disciplines. He has over 20 years of experience in developing long-range plans and urban design strategies, drafting code amendments, planning and implementing capital projects, and managing economic development tools. His prior work includes leading an urban design studio for the city of Dallas and developing plans and ordinances throughout Oklahoma, Texas, and Louisiana, including the city of Gonzales, as well as Ascension and St. John the Baptist parishes. David's practice has evolved to have an increasing emphasis on the connection between the built environment and human health, including managing capital improvements that address environmental conditions to improve both physical health and mental well-being. David holds a Bachelor of Science in Architectural Studies from the University of Texas at Austin and a Master of Regional Planning from Cornell University. David will be taking a deeper dive into the social determinants of health and their impacts on overall community health, with a particular emphasis on social connectedness. Now, before we begin, we will kick off the webinar with a quick poll to see where everyone is joining us from today. The poll should appear on your screen, and we will give everyone a few moments to respond. Okay. All right. It looks like most of our participants are in the southern region, which is great. And we also have a few from the Midwest, the Mid-Atlantic, and a few international participants. So welcome, everyone. With that, I will hand it over to Jessica to get started.
Thank you, Lanisha. Give me just a second to share my screen. Good morning, everybody. Oh, it looks like we need to stop sharing that screen. Okay, gotcha. Thanks.
Sorry about that.
Okay. Again, good morning, everyone. I'm Jessica Kemp with the Center for Planning Excellence. Thank you for having me today. I'm gonna, sorry, I'm trying to advance my slide. There we go. Okay, I just wanted to start by giving you all an overview of what I'm going to talk about. I'll provide a little introduction to Cpex. I know Lanisha already gave you, did some of that, and I'll also give an overview of social determinants of health, talk about the intersection of planning with social determinants of health, give a few statistics on population health in Louisiana that demonstrate why we need to be leveraging all available tools to address our health needs. And then spend the remainder of my presentation talking about the Louisiana Healthy Community Planning and Design initiative that we're developing at Cpex.
Jessica, before you get started, sorry, I just want to let everyone know that we do encourage you to ask questions in the Q&A box throughout the presentation, and we'll reserve a few minutes at the end to go through those questions and have a bit of discussion. Go ahead, Jessica.
Yeah, thank you. So who is Cpex? We champion the power of good planning to build healthy, sustainable communities across Louisiana through our work as policy advocates, educators, and planners. And as Lanisha mentioned, we're a nonprofit organization. We work statewide. Our mission is to bring people, culture, and planning together to make great communities happen. And on the right here, you see our 4 focus areas: great neighborhoods, quality places, transportation choices, civic education and engagement, and resilient communities. These are lenses through which we look at our work, but I think the important thing is that these things are always interconnected, and that's what we attempt. That's how we approach our planning projects, is to think about all of these things. Oh, I wanted to say one more thing. We do work at multiple scales, from the neighborhood to the municipal scale, parish, regional, and state, doing both planning work and policy work. So, social determinants of health. Many of you have likely heard of this, have been familiar with it. This is a concept that's been gaining traction for the last decade or so. And what this is basically, social determinants of health are factors outside of a healthcare setting that play an important role in determining people's health. And so you can see the things here in the pie chart: education access and quality, healthcare access and quality, neighborhood and built environment, social and community context, and economic stability. And so all of these things, I mean, neighborhood and built environment probably resonates most directly with planning, but all of these things are affected by planning. You know, do you live in a community where you have access to the kinds of transportation you need to access healthcare, good schools, good jobs, so that you can have economic stability, so that you can get a quality education? You know, do you live in a place where you can access those services that has a huge impact on your health. And the social and community context is a particularly fascinating piece of this pie, and David's going to be talking more about that in his presentation. So as we think, social determinants of health are connected to planning in all the different ways that the decisions we make as planners affect these different pieces of the pie. And this diagram is meant to show how those social determinants of health compare to the healthcare that we receive in a clinical setting, so far as the degree to which they impact your health. So many of you are probably familiar with the term zip code is destiny, and know that we can pretty accurately project someone's outcomes, life outcomes, simply by knowing their zip code, what their income's likely to be, what their education level is likely to be, and what their lifespan is likely to be. And this diagram here shows us why, for the health piece, that these socioeconomic factors, physical environment, these health behaviors that are all connected to the place that we live comprise 80% of our health outcomes, compared to only 20% of things that happen within a clinical setting, at the doctor's office, at the hospital. So that's an outsized impact that your built environment, the place that you live, and the way it's designed affects your health. And so one of the things that this diagram prompts us to think about, and this is something else you may have heard of, is, are we directing our efforts and resources in the right direction when we want to address our public health issues? So if only 20% of our health outcomes are determined by what happens in a healthcare setting, but we are focusing 90% of our time, energy, and resources on those settings, versus focusing those energy and resources on the 80% that's happening elsewhere in the places that we live, we have a wrong pocket problem, a mismatch between the resources and strategies we're using to improve health and the actual needs and impacts that we're observing. And so I think this is where planning comes in. And over the past several years, Cpex has increasingly been observing opportunities and needs to be using the tools of planning to address our public health interests and our public health concerns. And so we've been thinking a lot about how we can do that in Louisiana. What I have here are just a few statistics and that show the need. And these needs are across the nation, but Louisiana in particular has some very poor health outcomes. The Louisiana Department of Health report card shows that we're in the bottom 4 states for some of the most critical health outcomes: heart disease, stroke, obesity. And so we have a lot of room for improvement. And in the chart here that you see, the indicators: hypertension, diabetes, heart disease, mental health, obesity, and physical activity. These are all indicators that can be influenced significantly by the built environment. And so that's why we're focusing on these here. But you can see that Louisiana as a state is performing, in most cases, significantly worse than the US average. And then when you look at a municipality in Louisiana, and this is for Platte, and I want to point out that I didn't pull out Platte just because they have shocking statistics. We just happened to be working there, and so we had numbers pulled for them already. But the reason I want to provide this contrast between the local and the state is just to show how, for something like the first thing here, hypertension, where Louisiana is already more than 7 percentage points higher than the US average, then we look at Platte and see that we have some where it's 51%, almost 20% higher than the US average, that we have some pockets of need that really require place-based data and place-based strategies, and planning is the right tool for addressing those specific needs. One of the right tools. And just another thing that's critical for planning practitioners to keep in mind are health disparities. And so just to illustrate this, the Human Development Index is a tool that does on a regular basis, uses updated data across a range of indicators that include social determinants of health, like education and access to transportation and so forth, to create a human development index score that essentially assesses quality of life. And that score for Black Louisianians is at 2.93 versus 5.15 for white Louisianians. And so that is a stark disparity. And we see that play out in life expectancy as well, where life expectancy in Louisiana in general is 2.6 years less than the national average, but the life expectancy of Black men in Louisiana is 9.1 years less than the national average. And again, these are stark disparities that hold us back as a state. It's a human and social justice issue, and it requires some targeted strategies. And I think it's important to recognize also that a lack of planning or poor planning practices in the past have had a role in contributing to these disparities. And so it's very important that we think about how planning can address these health disparities in the future. One other thing I want to mention is, Louisiana is on the front lines of climate change. Everyone, no matter where you live, is affected by climate change, and as those climate change impacts increase, we will see increasing impacts on our public health. And so this includes temperature-related death and illness, air quality impacts that affect respiratory diseases, more disasters, which come with injuries and stress and loss of access to healthcare, disruptions in social cohesion, and then vector-borne diseases that can increase as habitats change for things like mosquitoes that carry disease. And so all of these things are going to be, the needle's going to be moving as we experience greater climate change impacts. And again, planning has a role in both, mitigating and adapting to climate change, but also we need to be thinking about how we plan and design our communities in a way to also mitigate and address those health impacts. So with all this in mind, Cpex has developed what we're calling the Louisiana Healthy Community Planning and Design Initiative. And our vision for this initiative that has been in the works for several years, but we've really only been able to kind of launch it in an outward facing way this past year. The vision for this over the long term is to establish a shared cross-sector understanding of needs and opportunities, to establish partnerships, methodology, a supportive policy environment, and capacity to provide healthy community planning and design services across the state, and then to continue to contribute data and evidence to inform planning efforts and provide decision-making support. And I'll elaborate on that just a little bit. What we want to see is a greater availability of data and knowledge, especially at the local level, to help develop planning strategies that will incorporate health objectives and concerns. Then finally, to develop and promote policies to encourage inclusion of health objectives in planning processes, and conversely, planning tools in public health strategies. So that's the vision. Our goals for the near term are to increase awareness and understanding among stakeholders and practitioners, and to cultivate champions. And hopefully that's some of what we're doing today, is to help communities, activists, elected officials, planning practitioners, public health practitioners have a more nuanced understanding of the connection between our built environment and our health, and feel empowered to take action to participate in planning processes, use planning processes to address public health needs and concerns. A second goal is to provide evidence-based decision-making support. I'll talk more about how we're doing that when I go over our pilot projects. And lastly, to develop a methodology and practice of integrating health data and goals into planning processes. And I just want to acknowledge, this is happening in other places. We're certainly not the first ones to think of this, but what we're focused on at Cpex is developing that methodology and practice that works in Louisiana. And so that means taking the Louisiana context, culturally, socially, politically, into consideration, understanding where communities are and what they would need in order to make progress on a planning effort that addresses public health needs, and also that's accessible. Having a methodology and a practice and a policy environment that makes it possible to make progress in this direction without having a huge budget, which is the situation that a lot of our communities are facing. And so in order to reach these goals, we have launched a series of pilot projects, and I'm just going to give kind of a high-level overview of these. We've done the East Baton Rouge Complete Streets and Parks Study, as well as the New Orleans Green Infrastructure Study. These are both efforts to contribute to that body of knowledge that would provide decision-making support that I mentioned before. And so these projects are a partnership with Blue Cross Blue Shield Louisiana, and we have been working with them to identify built environment interventions such as green infrastructure, complete streets amenities, and then do a longitudinal study of health outcomes for people living within a very tight radius of those amenities, about a mile, and to see what kind of associations we can make with the addition of that amenity, whatever it may be, to that community, and to see if we can track changes in health among the people who live in the area of that amenity, to start to have a better understanding of what kinds of amenities have what kinds of specific health impacts in particular types of communities. And the reason we're asking these questions is to address the issue of to provide support for a community that may have X number of dollars to invest in a park or a bike trail or a community garden, and to help them understand which one of those things is actually going to yield the greatest impact given their specific needs, their specific population. So this is just the tip of the iceberg, this initial partnership with Blue Cross Blue Shield in the study, but we're looking forward to continuing those research efforts and learning more so that we can provide that kind of granular decision-making support. The Bunkie Louisiana Complete Streets Action Plan is a partnership with a health-focused community organization called Move Bunkie Forward, and David's going to talk more about that in his presentation. The Joel J. Newman Community Center Accessibility Plan is a project where we've partnered with a community center that is situated in an underserved neighborhood in Baton Rouge, but has been kind of disconnected from the community by an interstate. That's a story we hear too often. And the community center provides a number of services that address those social determinants of health. It's social assistance, opportunities for social engagement, recreation. There's a health clinic, there's a gymnasium, there are exercise classes. I mean, it kind of just checks all the boxes. And so this project is focused on working with the community to figure out ways that we could reconnect it or better connect it to the community, and with a focus on active transportation. So that's a plan that's a project that we're wrapping up now. And then healthy community design plan layers for Ville Platte and Scotlandville. And so this is a project where we've enhanced existing planning efforts with a healthy community plan layer. So we've created a set of baseline health data, incorporated health objectives into the plans, and then provided strategies in the plan themselves that specifically address those health objectives. And so that's a step towards creating that methodology that brings health into planning efforts that I mentioned in the initiative goals earlier. That's just an overview of some of the things that we're doing to launch this initiative, to learn, to develop methodologies, and also to engage with communities and practitioners to just increase knowledge and understanding and get input and feedback. This is just an example from the Joel J. Newman Community Center Plan. And I wanted to highlight, I don't expect you all to be able to read this, but the community health profile that we developed. And we're doing this for the communities we're working in, where we look at those health measures on the left, and we're focused on indicators, again, that can be significantly influenced by the built environment. And we're doing this at the census tract level, so it's as local as possible, to see like where are the areas of specific need, and then to make sure that we are developing strategies that would potentially benefit people who are in those categories, who are experiencing those conditions. And so this is part of the baseline data that we want to incorporate into our healthy community planning efforts. We also, yeah.
Sorry, if we're going to go through all of the pilots, could we give a very high level overview, just in the interest of time and making sure there's enough for David's presentation and questions as well?
Sure, and I'm just giving some example of the deliverables. I'm not going to go through all the pilots.
Okay.
Thanks. The surveys also, I just wanted to point out that we included health behavior questions in the survey so that we could start to understand what kind of built environment interventions would actually encourage people to change their health behaviors in positive ways. And sorry, I'm having there we go. And then the Platte Pocket Park Plan, I just wanted to mention because this project speaks directly to the social cohesion, social determinant of health. And the mayor of Platte had this extraordinary vision that she wanted to increase social cohesion in her community and address racial barriers by creating spaces throughout the community that were explicitly designed to bring people together. And so I just thought that was a great example of an elected official who had the vision to be planning for public health, and we were really grateful to be able to work with them on that. And that is just a couple of the pages from that Platte plan. And finally, another part of our Healthy Community Design initiative is a resource guide that we're putting together that is meant to be very accessible, user-friendly, a resource to communities, elected officials, practitioners, advocates. That's just sort of a how to get started guide for people in Louisiana who want to, who are interested in health, who are interested in improving their communities, and to help them see the opportunities available to them as they think about planning and health. So it's kind of provides some tools, best practices on how to get started. And so we're planning on having that available to communities at the beginning of 2022. And so finally, as we're building this initiative and looking ahead, we see building partnerships is critical. We certainly can't do this alone. And so we're always looking for new partners to work with throughout the state. And so if any of you who are with us today are interested in such a thing, please, I encourage you to reach out to us. We see a lot of opportunity to do research and development of model policies. And so we're really focused on the practice side of it now, but the next phase of this work, we would like to focus on shaping the policy environment that would support this over the long term. Next, the evaluation and performance measures, so that we are learning as we go in a objective way, so that we can improve as we go along and document the performance of these efforts. And then lastly, the climate change impact strategy. That's going to be such a huge issue for us to contend with. It already is, and so we would like to really hone in on those strategies as we think about how to connect planning and public health. And that is the end of my presentation. Thank you all. I hope this was useful to you. And as Lanisha said, we'll have David and I will both be available for questions after his presentation. But for now, I will turn it over to him.
Great, thank you, Jessica. And as I am bringing up my presentation, we have, I believe, a couple of poll questions we want to put out there so we can kind of get a sense of kind of where everyone is at with respect to the health spectrum. And so there's 3 questions that we've got that we would love you to answer. Let me move that out of the way. First, do you currently have a health profile or assessment of your community? And so I think it's important as we go in as any planning activity for us to understand what are the baseline conditions and what are the opportunities where we might need to intervene or help to move the needle in the right direction. The second question is, has your community integrated any type of health element, health layer, or just sort of a dissection of the impact of your planning initiatives on health into your comprehensive planning process? And then the third question is really trying to understand what is the need with respect to your health needs in the community and how it relates to the built environment. So, what is the biggest planning need in your community to improve health? Whether that be from a policy perspective and regulating land use, to thinking about how and where public space and park space is distributed throughout your community and who has access to that. Are there adequate and ample opportunities to walk and bike in your community, or is that an area you might need to work on? As well as looking at the conditions of housing and aging housing and how might we mitigate some of the environmental factors there to better address health issues that might arise from indoor air quality or other issues affiliated with aging housing stock. And then the last one is around environmental quality and climate change, which is obviously something that is front of mind to a lot of us in Louisiana. And so with that, I'll give a couple more minutes for the poll questions to get answered, and then we'll review the responses. And here they come. So regarding the first question about whether there's an assessment out there, about half y'all aren't sure, which is actually expected. That's not something that we have typically really sort of tapped or utilized in the planning world as of yet, or to a large degree. And so understanding that, that's totally not a surprise there. Also pretty well split about whether there is any kind of health element to the plan. About a third say yes, a third say no, and a third aren't sure. And so pretty good cross-section there. And then as far as the biggest need, all of the above, not surprisingly being the one that most chose, but also active transportation and housing being the next 2 most common things. So that's, thank you for sharing your responses. And with that, oops, I hit the wrong button. I'll go ahead and kick us off as far as a deeper dive into the social determinants that Jessica mentioned. And when a lot of us think about health, we might think about kind of a Sophie's choice here that's exhibited on the screen. Granted, it's a pretty broad oversimplification given the many layers and complexities that Jessica laid out, but I think it's a good device to help us sort of think about how we make choices, or what influences or goes into our ability to even make this choice. And so, while I know that the image on the right and foods in the sort of green bean bucket are far better for me, and should certainly play a larger role in my diet. than the foods that fall into the bucket on the left, the sort of the greasy pizza, fast food, convenience type items. However, I, might strongly prefer the food on the left and the greasy pizza. It may also be what I have easiest access to or is most affordable to me. And so over time, I like it. It's easy to get to, and so I might default to that as a bit of a pattern of behavior. And certainly then that pattern has implications, inside my arteries. It has implications around my waist, and thankfully in the Zoom world that we live in, you can wear elastic pants every day and nobody really is none the wiser. But regardless, it just sort of goes to show that what is good for us and what we prefer to or most frequently do don't always align. And so how might that same kind of thinking then apply to the built environment? And certainly this is a lot more complex question than the first one, as far as understanding saturated fat and fiber and making some pretty clear cut distinctions. There's a whole lot of sort of inquiry and discussion right now about what is a healthy development pattern? What does that mean? And I think it depends on how you look at it, right? I mean, if you're looking at access to nature and air quality, maybe a more rural environment is better. Whereas, the ability to have active transportation options and access to, other amenities, it might tend towards the image on the right and the more complex mixed use development. And so, that's something that we're digging into and something that we're starting to think about is how we sort of assess and analyze the built environment and understand all the various ways that it influences our ultimate individual health. But today, I'm going to really drill down on one key issue, and that is on the social connectedness component and determinant of our health. And, generally speaking, our social connectedness is ultimately just how I as an individual relate to others. And we have a tendency to language this in a lot of ways. We talk about things like social cohesion or community cohesion, which is really looking at those, how those links operate at a community level and how tightly bound together we are at a community level. But we also think about words like inclusion and belonging. And so, but what I'm going to focus in on today is really about that sort of individual connection and how, we as individuals either do or don't have strong connections with others, and how that then translates into our health and how our built environment can then ultimately influence, our ability to have at least the opportunity to have those types of connections. And so there's been a whole lot of research over the last several years that has gone into that question about, kind of our social makeup and what does it mean for health. The graphic that I used here is from Emma Seppala, and she looks at really kind of how we are ultimately social creatures and how important those social bonds are. But there's also been a lot of research on, how that then translates into health. There's a professor out of BYU, Julianne Holt-Lundstad. She's a professor of psychology and neuroscience that has looked at both the influence of both the quality and quantity of human relationships and how that influences health. And what we're finding is that if you've got a strong social connection or strong social connectedness, you are more likely to live longer. You've got a stronger immune system. You feel better about yourself, and you understand and feel more deeply about those around you. And you have lower rates of anxiety and depression. Now, on the flip side of that, if you have low social connection, and there's one study out there that asked folks, how many people do you have to talk to about a problem, that you could feel comfortable doing that to? 25% of Americans said 0. And so in those instances where you have that kind of low social connection, you're also, or it's actually been found that it's worse for you than smoking, it's worse than high blood pressure, and it's worse than obesity, which was shocking to me when I read that. And I think, if we were all in a room together, that would be a question I would ask everybody, raise your hands if that's something that you were familiar with, because I sure wasn't. And in addition to that, if you have low social connection, you're also more likely to recover more slowly from disease. You have an increased likelihood of exhibiting violent behavior. You have higher levels of anxiety and depression, and it can even be traced down to higher levels of inflammation at the cellular level. So there is a very deep connection between our social health and our physical health. And when we think about how we apply that to our built environment and how that is related, there's a very clear connection there as well. There was an article in New Geography, and you're all familiar with that listserv that came out, but the headline was Social Connectedness and Sidewalks. I thought, oh, here's the silver bullet. But effectively what came back was there wasn't a connection with regard to whether or not there was a sidewalk in front of your house and how connected you were. So apologies to Jane Jacobs for that. However, and I think she would agree with this, there was a strong connection between our social connectedness and how proximate we were to parks, open spaces, and other social uses, such as cafes or coffee shops. And while there's a multitude of studies around our proximity to parks, and that being linked to not only more frequent park use, but the likelihood that we might regularly exercise more, but also better mental health, as well as I mentioned, better social connectedness. And in fact, for folks, whether it's an urban area or a suburban area, if you were living in a place that had greater access to amenities, you were more likely to trust those around you. In fact, 3/4 of the people in highly amenitized urban or suburban areas would trust their neighbors, at least a fair amount. Now, compare that to those living in low amenity areas, and the number drops to about 62%. And so there's a distinction there, a big relationship between how connected we are to the types of amenities that are around us. And certainly the slide on your screen, if you live in a highly amenitized area, you're also more likely to relate to strike up a conversation with a stranger. And by and large, about 1/3 of Americans live in places that are high or very high access to amenities. If you sort of then begin to include moderate levels of access, about 3/4 of us, kind of fall into that sort of moderate access to amenities and above. Now, this is certainly not universal across the board. You can see on the screen it differs by community type. Where we find that the rural areas are more likely to have lower access to amenities, which makes sense. Things are more spread apart. It's harder to get from place to place, and so there's some logic there. It also differs by race. In urban areas, Black Americans were twice as likely as white Americans to lack neighborhood amenities. And so, understanding at a granular level how that access differs is very important as we start to think about the planning implications for the built environment. It's also very interesting to note that in this same study that was done just recently, a question was asked, kind of where would you prefer to live? Would you want to live in places where the homes were further apart, the school and amenities were further away from you, or would you want to live into a more compact, walkable place? And of note, while the more dispersed environment has had a bit of an edge for a number of years, that gap has been increasing, where we've seen an increasing preference for those dispersed communities where we are less linked to those types of amenities. This is due in part, I think, as a reaction to the pandemic, where we've kind of started to prioritize our individual space over kind of communal places, but certainly this is interesting to note when we start to think about it's the dispersed areas that have the lower access to amenities. Also of note, when asked, compare where you live to where you would like to live, and are they the same? It was the rural communities were, by and large, the only place where a vast majority of folks said, yes, where I live is the type of community I want to live in. For the most of the rest of us, there was a strong desire to be somewhere else and to move somewhere else. And so this starts to kind of open up thoughts around, well, what are our preferences and how do those preferences impact our patterns of behavior? Certainly as we are drawn more towards dispersed environments, then we kind of have this sort of self-fulfilling cycle of automobile dependency, which certainly then has tentacles not only to kind of the social context that I was mentioning, but also to other determinants of health, such as the ability to walk or bike places, and certainly understanding how all of these relationships are interrelated to one another impacts how we should think about planning, and how we should think about planning from the perspective of just ensuring that we're thinking through the health implications as well as the social implications of the types of communities that we are creating. And so what can we do as planners, and how can we help to think about or help to influence social health or social connectedness rather, when our preferences and patterns of behavior lean us towards to communities where that is a little harder to come by. And so, I think the first step is certainly making it a very thoughtful and deliberate part of any local planning initiative. As we're thinking about our comprehensive plans or our small area plans, we need to think about, how is the type of place that we're creating, how is the world that we're constructing, establishing, access to those amenities that then open up the ability for us to maintain that very crucial and necessary sense of social connection with others. And how can we make sure that's integrated into every community, regardless of whether it's rural or a compact urban center? It needs to be front of mind as we start to think about the needs for each of those communities, and they're going to vary, obviously. And as we do so, we need to make sure that we're effectively making the healthy choice, so to speak, the easiest choice to make, so that we're putting out there opportunities for folks to enjoy those types of social interactions, striking up a conversation with a stranger, or just gathering, as Jessica mentioned, just apologies for that, in Platte, and making sure that that's a choice that's afforded to everyone. There is the ability to sort of level the playing field and create that equitable access to those types of social environments, open space environments, shops and restaurants and cafes and other kind of third place types of environments. And so an area that we're looking at this specifically now, as Jessica mentioned earlier on, is in a community, Bunkie, Louisiana, and we're doing this as part of a complete streets strategy that's funded by the Louisiana Department of Health. But it's more than that. We're also starting to think about, well, where is there open space? Where are those social hubs? Who has easy access and close proximity to those types of environments? And where might there be holes, and how can we strategize as a community to help fill those gaps? And again, give access throughout the community to the types of locations and the types of built environment that are going to foster that strong social connection that, as I walked through early on, has tremendous health benefits and health impacts for us. And so it's not so much about a choice of one versus the other, really. It's more about how can we make each community as strong as it possibly can be, as equitable as it possibly can be with respect to our access to the types of environment that's necessary for us to build that type of deep and meaningful and cohesive connection amongst our community. And so with that, I will stop sharing and invite Jessica to join us back up here for questions. I think that we might have a couple that have come in that Lanisha can help moderate us through a discussion here for the last few minutes.
Thanks, David, and thank you, Jessica, for your great and informative presentations. We'd invite everyone, or if you have any questions, you can submit them now in the Q&A. And as questions are coming in, I'll just review the ones that we received so far. So someone asked if the pilot studies that Jessica gave an overview of will be available to the public at any time. And the answer is yes, they will be in our Healthy Community Planning and Design Guide, which will be released in early 2022. And Jessica, I imagine it would also be available on our website, cpex.org, so that people can easily access it.
Yes,
Great.
Absolutely.
And the other that came in was not a question, but a comment, and it was to David's polling question. And someone says that they would like to propose another option to address the planning need in their community that will address health impacts. They need more health-related curriculum in school from K through 12. So I think that's a very good option as well. And well, Jessica responded to that and let that person know that if they would like to get in touch to discuss more, that they can reach out to her. And I'm not sure, was I sharing the Q&A screen before? Sorry about that. And their emails are available if anyone would like to reach out. So if there are any other questions, we'll give a few minutes for people to submit. I guess in the meantime, Jessica and David, if you have any closing thoughts that you would like to share with the group. No
Sure.
pressure.
Yeah. Lanisha, do you want to share the question that just came up?
Oh, sure. So where do you think environmental education fits in improving social connectiveness and health? And that is.
David, do you have a thought on that? If not, I'll jump in.
Well, and I think it's certainly a critical component, and yeah, where I sort of mentioned briefly, the sort of climate change and environmental issues and how critical those are. So it's certainly, I think, one of the very key determinants of our health, and something that we're thinking through very carefully about. Not only impacts to air quality, but heat-related death and illness as a result of global warming, and as well as thinking about impacts from disasters and the toll that takes from stress, as well as sort of direct loss of life.
Okay. Jessica, do you want to comment on that one or move on to the other one?
I think he covered it, and we have another great question. So let's move on.
Sure. So this question comes from Lauren. What has been the response from elected and appointed officials when health supporting planning activities have been discussed with them?
I'd love to jump in on that one, because we've had a really positive response, because these issues they're quality of life issues. And so that's important to our elected officials when they're thinking about their residents. And I think they also recognize that the need for very local strategies to complement the federal and state strategies and policies that are in place. And there's also this question of livability and attracting residents and being a place that people want to live. These are all important to our elected officials, and people are increasingly seeking places where they can live a healthy lifestyle. And so being able to offer those sorts of amenities is a boon to a community who can say, like, you can live here and walk to work and enjoy lots of green space and have good clean air and water. So those are very desirable features for a community to have that helps build population and attract visitors. And I know some of our friends in the Alexandria area are thinking really carefully about how to design and market their region as a place where people can enjoy economic opportunity, small town living, and a healthy lifestyle. And they recognize that as a real draw. So I think that's fantastic.
Okay, thank you. We have another question that just came in. What's the low-hanging fruit that we can do that helps encourage the shift to better/healthier built environments in our local areas? I can read it again if you need it.
I can maybe start that, and then Jessica can elaborate on it. And this is actually a question that we're looking at specifically in Bunkie, because the community is looking for what is a quick win, what's something that's accessible and easy to do that wouldn't require waiting on a huge capital investment to come in. And so we're working with that community just to figure out, well, where are changes that are easy as introducing crosswalks at particular locations to help make the journey across the street to the shop from your parking spot safer. How can we think about some kind of walking route within their core that not only connects folks in the community, but it also sort of ties into their main downtown area where there's a lot of social uses, as well as kind of a wellness district that they've established that has a lot of open space and recreational opportunities. And so it's really starting to work with and connect the dots of the assets that are on the ground there.
Yeah, I think that's a great example. And I think in any community, one of the first and easiest things you can do is identify what are the barriers to using what you already have. And we found that in particularly in some of the more rural communities, education and programming is really key. Because, for instance, in a community we worked in St. Helena Parish, we were mapping out some sidewalks and complete streets amenities, and we got feedback from residents that let us know that this was not a build it and they will come kind of situation, and that there was actually a stigma attached to walking in their community, which alerted us to the need to reframe walking as not I'm broke and don't have a car, but I'm out, enjoying the day, getting some exercise, maybe spending some time with a friend, connecting with neighbors. And so that was really important to design programming and public messaging that invited to think about participating in active transportation differently. And so I think that's just one example of how, sometimes it's messaging, it's programming, it's addressing a relatively easy to fix barrier, such as, our sidewalks overgrown. Does this park feel unwelcoming because it needs lighting, or, just things like that, where a small investment or change could really change the way that people interact with amenities that are already there.
Okay, great. So that was our last question. So I think we can go ahead and wrap up. We're also just at time. So again, I'd like to thank you, Jessica and David, for your presentations today, and everyone who attended as well. Again, the webinar recording will be available on Cpex's YouTube channel, and we will also be sending out an email to everyone with that link so that you can view and share it again if you so feel. And when you exit the webinar, you will be asked to complete a short evaluation survey. So please take a moment to complete that survey and provide feedback so that APA Metro Chapter can continue to provide valuable webinars and events to you. Additionally, please keep an eye out for the APA Metro newsletter, which would provide details about future upcoming Lunch and Learn events. And lastly, just one last plug for those in the New Orleans area, the APA Metro will be having its joint holiday party with UNO Plus this Friday on December 17th from 5 to 7:30 at Bayou Bear Garden. And so if you're in the area, we encourage you to come and attend and do some networking with planners. And with that, thanks again to everyone, and hope you have a good day.